A collection of procedures which includes the handling of gametes or embryos outside the body to achieve pregnancy is known as assistive reproductive technology. It increases the chance of pregnancy in infertile couples. Artificial assisted reproductive technology includes intrauterine insemination or artificial insemination and in vitro fertilization, embryo transfer, zygote intrafallopian transfer, gamete intrafallopian transfer, intracytoplasmic sperm injection, pre-implantation genetic diagnosis, oocyte and sperm donation, and surrogacy. Intrauterine insemination. This is a small procedure to treat infertile male with low sperm count. The semen is collected either from the husband or from a healthy donor and is introduced into the uterus through the vagina by a catheter after stimulating the ovaries to produce more ova. The sperm swing towards the fallopian tubes to fertilize the egg, resulting in normal pregnancy. In vitro fertilization or test tube baby. In this technique, the sperm and eggs are allowed to unite outside the body in a laboratory. One or more fertilized eggs may be transferred into the human's uterus where they may implant in the uterine lining and develop excess embryos may be cryopreserved frozen for future use. Initially, IVF was used to treat women with blocked, damaged or absent fallopian tubes. Today, IVF is used to treat many causes of infertility. The basic treatment steps in the IVF treatment cycle are ovarian stimulation, egg retrieval, fertilization, embryo culture and embryo transfer. Egg retrieval is done by minor surgery after genital anesthesia using ultrasound guide after 34 to 37 hours of chorion egg gonadotropin injection. The eggs are prepared and stripped from the surrounding cells. At the same time, sperm preparation is done using a sperm media. After preparing the sperms, the eggs are brought together. 10,000 to 1 lakh motile sperms are needed for each egg. Then the zygote is allowed to divide in form 8 called blastomere and then transferred into the uterus for a successful pregnancy. The transfer of an embryo with more than 8 blastomere stage into uterus is called embryo transfer technique. Cryopreservation of embryos is often used more than when there are more than embryos than needed for a single IVF transfer. Embryo cryopreservation can provide an additional opportunity for pregnancy through a frozen embryo transfer (FET) without undergoing another ovarian stimulation and retrieval. Zygote intrafallopian transfer (ZIFT). As in IVF, the zygote up to 8 blastomere stage is transferred to the fallopian tube by laparoscopy. The zygote continues its natural divisions and migrates towards the uterus where it gets implanted. Intrauterine transfer. Embryo with more than 8 blastomeres is inserted into uterus to complete its further development. Gamete intrafallopian transfer. Transfer of an ovum collected from a donor into the fallopian tube. In this, the eggs are collected from the ovaries and placed with the sperms in one of the fallopian tubes. The zygote travels towards the uterus and gets implanted in the inner lining of the uterus. Intracytoplasmic sperm injection. In this method, only one sperm is injected into the focal point of the egg to fertilize. The sperm is carefully injected into the cytoplasm of the egg. Fertilization occurs in 75 to 80% of the eggs injected with the sperms. The zygote is allowed to divide to form an 8-celled blastomere and then transferred to the uterus to develop a protective pregnancy. Surrogacy is a method-assisted reproduction or agreement whereby a woman carries a pregnancy for another person will become the newborn child's parents after birth. Though through in vitro fertilization, IVF embryos are created in a lab and are transferred into the surrogate mother's uterus. Azoospermia is defined as the absence of spermatozoa in the ejaculate semen of at least 2 occasions and is observed approximately in 1% of the population. Microtesticular sperm extraction. Microsurgical sperm retrieval from the testicle involves a small midline incision in the scrotum through which one of Both the testicles can be seen under the microscope. The seminiferous tubules are dilated and a small amount of testicular tissue in areas of active sperm production are removed and improved for sperm yield compared to traditional biopsy techniques. Amniocentesis involves taking a small sample of the amniotic fluid that surrounds the fetus to diagnose for chromosomal abnormalities. Amniocentesis is generally performed in a pregnant woman between the 15th and 20th weeks of pregnancy by inserting a long, thin needle through the abdomen into the amniotic sac to withdraw a small sample of amniotic fluid. The amniotic fluid contains called cell shred from the fetus. Chorionic villus sampling (CVS) is a prenatal test that involves taking a sample of the placental tissue to test for chromosomal abnormalities. Fetoscope is used to monitor the fetal heart rate and other functions during late pregnancy and labor. The average fetal heart rate is between 120 to 160 beats per minute, and an abnormal fetal heart rate or pattern may mean that the fetus is not getting enough oxygen and indicates other problems. Breast is divided into four quadrants. The center nipple, which is the fifth quadrant. Each quadrant of the breast is felt for lumps using the palm of the opposite hand. The the examination is done in both lying down and standing positions monthly once after the first week of menstrual cycle. This way, if there are lumps or any deviation of the nipple or to one side or any blood discharge from the nipple, we can identify cancer at an early stage. Mammograms are usually done for women above the age of 40 years and the young girls and women below 40 years. Ultrasound of breast aids in early diagnosis of breast cancer. A handheld Doppler device is often used during prenatal visits to counter the fetal heart rate. During labor, continuous electronic fetal monitoring is often used. Vitamin A is called as anti-sterility vitamin as it helps the normal functioning of reproductive structures. Sex hormones were discovered by Adolf Buchanan. 11th July is observed as the World Population Day. 1st December is observed as the World AIDS Day. National AIDS Control Organization was established in 1992. Syphilis and gonorrhea are commonly used as international diseases.